Hello and welcome to WindyCityWebcast.tv. I'm Merissa Marks with the latest in health news. Mexico tops the list of the world's most overweight industrialized nations. Nearly a third of Mexican adults are obese. A recent United Nations Food and Agricultural Organization report says, topping even the United States, which comes in at a close second at 31.8. The United States has long been a fixture on the list. The cause? High calorie, low cost, processed food, and increasingly sedentary lifestyles. As Mexican incomes rise and more people move into metropolitan areas, the danger, according to the World Health Organization, is an increased risk of cardiovascular disease, diabetes, degenerate joint diseases, and some cancers. The obesity epidemic is just another problem for Mexican children, who can be both malnourished and overweight. Arsenic in apple juice has received a lot of attention in recent years, although some say the concern is unwarranted. After encouragement from consumer groups, the U.S. Food and Drug Administration has conducted their own investigation and is proposing a maximum limit for arsenic levels in apple juice. The FDA plans to limit the amount of inorganic arsenic to 10 parts per billion, the same amount the Environmental Protection Agency allows in drinking water. This is the first time the FDA has set limits for arsenic levels in food or drink products. The move also comes 2 years after an episode of the Dr. Oz show raised public concern about the amount of arsenic in children's apple juice. Activists are organizing the first National Gay Blood Drive Friday in an effort to combat the FDA's ban on blood donations from gay and bisexual men. The FDA bans donations from men who have had sex with other men since 1977, saying there is an increased risk of exposure to and transmitting of infectious diseases, including HIV in male-to-male sexual encounters. Blood banks have been instructed to ask if male donors have ever had sex with a man. If the potential donor responds yes, he is instantly removed from the donor pool for life. Many people feel that using artificial sweeteners instead of sugar is a healthier choice, but researchers are now saying the opposite may be true. The American Heart Association suggests that people should avoid added sugars, which are sugars and syrups put in foods during preparation, processing, or right before consumption. Sugar intake has been linked to obesity, type 2 diabetes, and metabolic syndrome, which includes risk factors for heart disease and stroke. Pixie Scientific has created a smart diaper that tests babies' urine. Parents can then scan the QR code on the diaper and receive information about their child's health. The device claims to track changes in a baby's urine, potentially showing signs of urinary tract infections, dehydration, or risks for kidney problems. When a baby pees, test strips surrounding the QR code will pick up the waste and start the testing process. Parents are asked to scan the QR code located on the back of the baby's smart diaper once a day with their smartphones. The app's algorithms will instantly analyze the contents. According to the makers, scanning the diaper daily can provide a picture of any changes that may signal health problems. Thanks for joining us. Be sure to follow us on Twitter and friend us on Facebook. I'm Merissa Marks for WindyCityWebcast.tv.